Hello everyone. In this session we will discuss about economic evaluation. Um, Whenever we are talking about economic evaluation, the first word says us that again we are discussing something about economics, and something related to economic variables or economic perspectives. Now, economic evaluation being one of the core and most important area studied under health economics, or uh, this is a subject or a stream under health economics which tries to estimate the economic impacts of a particular process, healthcare process. And why it is important or unique is, before going to that, why it is unique or important, we know it is important because we have to estimate the benefit against the costs of a particular process. Now, as during our lectures we have learned that it has been really difficult to quantify health as a particular commodity or just one service, just one unit. Quantifying under one unit has really been difficult because of its heterogeneous characteristics, as well as and its volatile nature in terms of several components under health services, or be it from the demand side or from the supply side. So what we generally look at when we kind of demand for healthcare, or we try to purchase healthcare as a product or as a service. So the first thing is, of course, we look at when we purchase healthcare, the first thing we look at, of course, as any rational buyer, the price of the product, right? Price of the services, price of the medicine, price of a diagnostic service. So the first thing is price. The second thing is, of course, the quality, because health is an area where quality is very important. The margin of error is very low, and we all look at the maximum effectiveness. Therefore, and the effectiveness in terms of how my health is being better off, being improved. So that is and if it is really making sense, if it is increasing my health, it is increasing my satisfaction to that extent which I want, which should be, then quality is ensured. So it's not only the price, people also look at the quality whenever it comes about healthcare. And then the third one is, as I said, that effectiveness. Even if the better quality may not be the most effective for me, because effectiveness has been always a relative measure. You pay more, maybe the particular treatment process is more effective, but paying more is always not a possibility. So because considering affordability, considering accessibility, effectiveness, whenever we talk about effectiveness, we have to talk about what kind of inputs the resources I am pouring in, and based on that, what is the effectiveness, and whether the kind of input I am giving, that is giving me the right outcome or desired outcome. So the effectiveness cannot be just in terms of the health I have gained, and again measuring health, what I have gained, has remained a challenge. And this effectiveness, related to price, and finally related to likely outcome, will be measured under cost effectiveness analysis, or economic evaluation. Techniques. Yeah. However, getting these things right, both price, quality, effectiveness, likely outcome, getting these things right are very challenging. That's primarily because the market imperfection in healthcare. Why this market imperfection in healthcare? We have learned that there is inefficient output, there is high level of externality, there is lack of information among the buyers, among the suppliers, moral hazard when somebody purchases a life insurance. From the life insurance perspective, there is adverse selection, the externalities which is untapped, the market power. So all these, and then the demand and supply, demand and consumer and supplier nexus. So there are several things which actually play a major role, pushing that towards market imperfection. And when there is a market imperfection, so the getting the price right, or getting an idea about the right price, getting the idea about the right quality or its effectiveness or the likely outcome, all have been under question as far as the when a person ventures in healthcare market, or as a consumer asks for the healthcare as a product or services. So these all have not really made their the decisions very efficient. But the challenge remains challenge. Still we try to estimate the economic impact of a particular process. It can be a treatment process, it can be a production process, it can be an operational process. So and because everything has an outcome, right? And then the challenge is that how we measure this outcome. Therefore, whenever we are thinking about this, based on inputs, we are evaluating the processes, looking at the outcomes. So if I place it like this, I have a list of inputs. Now it goes past the processes, and finally it has output or outcomes, right? And these inputs are the doctors, staffs, so the training, equipments, medicines, and so on and so forth, diagnostic systems. The processes can be the treatment processes, several treatment processes, different drugs, and here we are talking about the alternatives or the choices available, alternatives or choices. And these outcomes are primarily my health outcomes, in terms of maybe we have outcomes like disability adjusted life here, length of stay or average length of hospital stays. So all these can be my eventually my satisfaction out of these, the opportunity cost gained, that means the benefits, several ways. So I can measure these outcomes of my or the days to take up the days of a treatment process. Lesser the number of days of a treatment process, the better my outcome is. So but again you see that getting these outcomes in terms of health is not an easy task, as far as this quantification is concerned, right? So basically then what does this economic evaluation do? The economic evaluation first sets its objective, before objective maybe it's the premise is primarily health research, healthcare research. The objective can be two ways, allocative or objective is to gain efficiency primarily, but to maximize health gain with available resources. So which talks about efficiency, right? And then efficiency, as we learned, can be either allocative efficiency, which says that benefit is maximized based on the best allocation, benefit is maximized based on the best allocation, so that the opportunity cost lost is reduced, and that is how I estimate the benefit. My opportunity lost, my opportunity foregone, that is reduced. That means I am not losing much. That should be the priority. And the technical efficiency, where you again maximize your benefit based on the given resources, or minimize the cost, get an optimum minimum minimized cost, to achieve a particular amount of production. Finally, the methods, in a nutshell, the compare costs and consequences. That's the benefits, right, of an intervention, or of several of alternative interventions. Yes. So and while we are comparing between the cost and consequences, we have to balance, between which we balance. One is cost and consequences, or I will say benefits. Yes. And the other one is inputs and outputs, because what is falling in between is process, right? In both the ways, the process is what we are trying to evaluate. Yeah. And understanding the cost and the benefit, as well as the input and the output. Now the final thing is economic evaluation. After we compare, then that can be considered as economic evaluation, which is criteria, setting a criteria of making choices, right? By definition, this economic evaluation can be known as the comparative analysis of alternative courses of action in terms of both their costs and their consequences. This definition is given by Drummond et al. In the year of 1997. Yes. So to do this economic evaluation, we will require two things. One, a comparison between two or more alternatives. Two, examination of both costs and consequences or benefits, right? So we basically do these two things. In terms of health, intervention basically measures, involves two measures. In terms of health, it has two measures. One, health effects from an intervention, from several interventions, targeting the same thing, of course. Number two, value or efficiency of the effects. So which basically means that in terms of intervention, I have a health effect, right? That's what the primary target is. So now my health effect, is it, or are they really valuable? Are they really making sense to me, right? I went to a doctor so that I don't, I have a movement problem in my legs. So I went to a doctor, he did something, and then I used to feel a pain on my knees. Now probably the pain is gone, but I still am not comfortable, while walking. My problem persists, but only the thing, the knee pain is gone. So the value eventually, because my major problem was not probably the knee pain, my major problem was difficulty in movement, and the difficulty in movement that sustains, what is gone is the secondary problem. So the value which I gained eventually by that intervention is not making me that sense. So we have to, we know the health effects, we know there is some positive effect, but in terms of that health effects also, we need to bring a comparison, that how efficient are those effects. So therefore, while we are doing an economic evaluation, say for, it can be a hospitalization process, it can be an awareness generation program under public health operations, it can be an immunization program, it can be say a treatment based or clinical program, pharmaceutical program. So, and which requires different types of, based on different outcomes, they will require different types of interventions, like, right, economic evaluation methods or techniques. So there are primarily 4 techniques or 5 techniques of economic evaluation. I will say that there are basically 4 economic evaluation techniques. Though the first one is very rudimentary in nature, very simplistic in nature, let us start with that itself, and not considering that, we have 4. Let us see. So how we try to understand that which particular economic evaluation technique we will use. So the first question we ask while deciding an appropriate economic evaluation technique is, so I will write it, types of economic evaluation. So first question we ask, is there a good evidence? Let me just use some other color. On effectiveness of interventions being compared. Yeah. So if I don't have any evidence, I can't do anything, right? If I don't have much evidence, because I'm not sure that what is the basically what are the effects, and if we are not very sure, we cannot really compare based on the effects, right? So, and still, if I am asked to make a decision or make a judgment that which one I will take, as it is an economic evaluation, as we need to bring an an optimization, we need to achieve an optimization, minimizing cost or maximizing benefit, and we are unsure about the benefit component, we go for this minimizing cost, right? So it's simply, then in that case, we do a costing study. Simply, if no, then we do a costing study. Yes, but if yes, then the next question we ask is effectiveness of interventions are equal or not? Effectiveness of interventions are equal or not, right? And I raise a question on this. If they are equal, then the second question comes, okay, that whether they are equal or not, then I will choose maybe a different color here. And if it is yes, then we do cost minimization analysis. That means now I have from here to here the difference is I have idea about my interventions or my outcomes, right? Outcomes of the interventions. Now I have got the good evidence. Yes. So once I have the good evidence, then I can start comparing between the cost between the interventions and I mean both the costs as well as its impact on the effectiveness. And then once we started doing that, the first question we asked that whether the effectiveness is similar or not, are equal or not. And if they are equal, that both these, whatever process we do, both the effectiveness is same, then if they are same, we straight away ask for both of them, my result is same, my outcome is same, and if my outcome is same, I will of course choose which is the cheaper one, right? So there my objective is straight away minimize the cost. So it is known as the cost minimization analysis, right? Once we this we don't have, we have idea about the effectiveness, but they are not similar. So we come to this no now, right? So over here now I ask the question that can all outcomes, now my interventions are not similar, yes I know that. Then the next question, okay fine, they are not similar. Now can these interventions or can this effectiveness or the outcome can be valued in monetary terms, can the outcomes be valued in monetary terms, right? It again has a yes and no. Yes, so if it is yes, then we do cost benefit analysis. If the outcome can be measured in monetary terms. But if no, then we ask a further question. I will keep it like this. If it is no, then we ask another question. Then the question is, can outcomes be measured as quality adjusted life years? Yeah. In terms of quality adjusted life years, QALY or DALY, or disease adjusted life years, we will learn about them, yeah, what is QALY and what is DALY when we learn about this particular technique, yeah, more closely. So, and we see that again the response is yes and no. If they are no, that they cannot be measured in terms of quality adjusted life years, then we will do cost effectiveness analysis, and if it is yes, then we do cost utility analysis. Let us see. So this is my cost effectiveness analysis, and this is my cost utility analysis. Again, utility or satisfaction is not easy to measure or quantify. That is why we measure in terms of QALY or DALY. That is, this QALY or DALY says primarily that the number of years a person either is losing because of a particular disease, or the quality of QALY is primarily, even if we talk about DALY, but QALY is the sole measure which gives an estimate about the satisfaction. Yeah, but we still can keep DALY because it's very difficult to estimate QALY because it's very relative, it's very abstract in nature, as the utility is, the satisfaction is, it's very abstract in nature. So so we often do supplement QALY with DALY. Yes, we will talk about this more in after some times, but So we'll slowly start understanding that these economic evaluation techniques. So we know that the costing studies, basically we are not able to compare between effectiveness or two effectiveness, so we can't really do much here. So we want to be talking over here, so we are restricting in four, which are basically the economic evaluation, because we evaluate the effectiveness, and we have idea about those effectiveness from this cost minimization, cost benefit, cost effectiveness, and cost utility. So we have four here. This is 1, this is 2, this is 3, and this is 4. While I am describing, I will not follow this order. First I will talk about cost minimization, then we will go to cost effectiveness analysis. Thank you.